I'm Elizabeth, and I'm a Zejula Patient Ambassador. I started yoga actually about 16 years ago, before I was even a mom. And I tried it sort of on a lark. My gym had it. And after I did it once, I was hooked. And I realized too that it really got me into shape. It was a really fun way to stay in shape. And now it's something that keeps me not only physically healthy, but mentally healthy. I feel really strong when I'm doing yoga. One of my first memories of my childhood growing up in Savannah, Georgia was watching my grandmother put on makeup. And she was, to me, just the epitome of a beautiful Southern lady. And I believe it was through her that I really began to appreciate finding beauty, real beauty, classic beauty, not beauty pageant beauty or Hollywood glam, more beauty that inspires. Cancer wasn't part of this story of beauty and love, but there it was, uninvited, in our house, in our lives, and in our marriage. It all started when I was losing weight without diet or exercise, which I thought, perfect, let's not stop this at all. But I started having these other symptoms as well. One of the big things was, despite the weight loss, I had this belly that kept getting more and more swollen. Along with that, I had cramping, I had bloating, I had low energy. I mean, what woman doesn't get tired, crampy, and bloated? But this kept going on, and things felt different. And I took the advice that I usually give other people: you know your body, you know yourself, just at least check it out. Because I was healthy and relatively young and had no family history of ovarian cancer, I was misdiagnosed with a ruptured ovarian cyst. Of course, a month later, the symptoms were worse, and at this point, my belly looked 6 months pregnant. So at that point, I went back to my OBGYN's office, where he then did a CA-125 lab test. And a few days later, he called and said, I believe you have ovarian cancer, and I'm going to refer you to an oncologist. Still at this point, I felt like cancer happens to other people. I'm sure that's not it. I didn't have time for it. It wasn't on my calendar. I was way too busy for cancer. So after a small examination, we went into my doctor's office, and that's where we heard for the first time, you have ovarian cancer. She said that this disease spreads quickly, so we have to act really fast. She said, we're gonna put you in surgery in 4 days. You're gonna start 6 rounds of chemo, and you'll not be returning to work. And I was like, wait, what? It wasn't anything I was prepared to process. So my first surgery was a full hysterectomy. And when I woke up from the surgery, I had been told by my oncologist, we're really not gonna know what we're looking at until we open you up. Before the surgery, they injected me with a dye, and the dye was to light up any cancer that was in my body. And she told my husband and I that when they opened me up, I was glowing like a Christmas tree. And the great part about that was, because of it, she said she got every single speck out. So after the surgery, we waited about 6 weeks for me to get strong, and I started chemotherapy. It was a pretty intense chemo for ovarian cancer. When I started losing my hair, it was hard. I thought I was prepared for it, but I don't think you're ever prepared to lose your hair all in one day. My husband was the one to say, babe, it's time. It's time to shave it off.
So I cut my own hair. So I said, hey, you know what, this would be kind of fun. Let's just finish the job and I'll do it for you. And, so I brought the stuff out, and, we made it fun and we joked about it. And that night, I could tell that she was sad. I mean, this is a woman who loves her hair. and just, it was part of her identity. I mean, to me, she was still beautiful. Like, she was still the woman that I met, and, I loved her to death, and we were laying in bed, and like I said, I can tell when she was down and things weren't going right. So I assumed it was because of her hair. And I just kind of leaned over and whispered to her, and I said, you're still beautiful to me, no matter what. So, yeah.
I bought 2 of the exact same wig, and the wig was called the Cheyenne. Perfect. I've got Cheyenne 1 and Cheyenne 2, and we were good friends throughout that process. The first time I responded to chemotherapy, I was considered cancer-free for 10 months. When I was in response my second time, after chemo, my doctor did tell me, based on your history, we'll probably find cancer in half the time as before. So that gave me 5 months. But I was really determined to not let that happen. My nurse had called me after my lab work to tell me the results, and she said, there is something new that we're waiting on. It hasn't been FDA approved yet. It's called niraparib. Look it up. And I thought, well, it may not be available to the public now, but I'm going to make it available to me. So I emailed Tesoro and gave them my sob story. And within 24 hours, I got a response from a real person who said, we'd love to talk with you. And as it turned out, when we finally spoke, she said, it just hit the market last week. When I first started taking Zejula, I did 300 milligrams. My platelet levels plummeted. And in fact, my nurse said, if you can't get your levels back up to where they need to be within a 28-day period, you're never going to be able to take the drug again. So we were getting pretty close to that time frame. But luckily, everything got to where it needed to be. My levels were fine, and I then started back on 100 milligrams. And that has been the dose that has worked for me. My CT scans are clear, and my doctor feels that Zejula is a good choice for me. I have started a few new hobbies and activities. One of the things I started was tap dancing, and I've been committed to it twice a week. When I first started taking tap, I met a lot of great people who just loved to dance, and that was really our common bond. Over the last year, we've developed relationships, and what a great thing we get to do. We get to dance every week and celebrate life together. And it's been a really fun journey with these ladies.
What I most admire about Elizabeth is just, through all this, her strength and her ability to stay positive. Always the thing that comes to mind when she was doing chemo, she would dress up. I mean, she would put makeup on, put on nice clothes, and just, like we were just going out to dinner. Even around the kids, like she always got up out of bed and, made herself look nice. She didn't, look like she was sad or sick. That takes a lot.
The perception of cancer or life-threatening illnesses is that your life has to be ugly as a result of going through that. You can no longer have the luxury of being beautiful. It's not important for you to focus on how you look. It's important for you to focus on getting well. But I think the two are connected. And I feel as though, although cancer is an ugly disease, I want the message to be out there that that doesn't mean your life has to be ugly. You can still experience beauty in yourself, in your family, in your surroundings. And for me, that beauty gave me hope.
Important safety information. Zejula may cause serious side effects, including bone marrow problems called myelodysplastic syndrome, MDS, or a type of blood cancer called acute myeloid leukemia, AML. Some people who have ovarian cancer and who have received previous treatment with chemotherapy or certain other medicines for their cancer have developed MDS or AML during treatment with Zejula. MDS or AML may lead to death. Symptoms of low blood cell counts, low red blood cells, low white blood cells, and low platelets are common during treatment with Zejula. but they can be a sign of serious bone marrow problems, including MDS or AML. These symptoms may include the following: weakness, feeling tired, weight loss, frequent infections, fever, shortness of breath, blood in urine or stool, bruising or bleeding more easily. Your doctor will do blood tests to check your blood cell counts before treatment with Zejula. You will be tested weekly for the first month of treatment with Zejula, monthly for the next 11 months of treatment, and from time to time afterward. High blood pressure is common during treatment with Zejula, and it can become serious. Your doctor will check your blood pressure and heart rate monthly for the first year during your treatment with Zejula, and as needed afterward. Your doctor may lower the dose of Zejula to treat high blood pressure. Before starting to take Zejula, tell your doctor about all of your medical conditions, including if you have heart problems, have high blood pressure, are pregnant, or plan to become pregnant. Zejula may harm an unborn baby and may cause loss of pregnancy, miscarriage. If you are able to become pregnant, you should use effective birth control, contraception, during treatment with Zejula and for 6 months after taking the last dose of Zejula. If you are able to become pregnant, your doctor may perform a pregnancy test before you start treatment with Zejula. You should tell your doctor right away if you become pregnant, are breastfeeding or plan to breastfeed. Zejula may harm your baby. You should not breastfeed your baby during treatment with Zejula and for 1 month after taking the last dose of Zejula. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Zejula include the following: heart not beating regularly, nausea, constipation, vomiting, pain in the stomach area, mouth sores, diarrhea, indigestion or heartburn, dry mouth, tiredness, loss of appetite, urinary tract infection, shortness of breath, cough, rash, change in liver function blood tests, pain in your joints, muscles, and back, headache, dizziness, change in the way food tastes, trouble sleeping, anxiety, sore throat. If you have certain side effects, then your doctor may change your dose of Zejula, temporarily stop your treatment with Zejula, or permanently stop treatment with Zejula. These are not all the possible side effects of Zejula. For more information, ask your doctor or pharmacist. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information.